Good afternoon. I'm joined today by Dr Vin Diwakar, NHS England's Regional Medical Director for London, and by Martin Hewitt, Chair of the National Police Chiefs Council. As you know, we remained locked in a fight against coronavirus. The pandemic has occupied our lives for many months, and we are now grappling with the emergence of a new and more infectious strain. Today, 45,533 people have tested positive for coronavirus. As of the 10th of January, 35,075 people are currently in hospital with coronavirus. That is an increase of 22% from this time last week. And sadly, of those who have tested positive for coronavirus across all settings, 83,203 people have died. 1,243 fatalities were reported yesterday. We know that most of the public are doing exactly that. They are doing the right thing and they are staying at home. And I want to say thank you to the millions of people who are putting our country's collective health first. To everyone who has put off seeing their parents, grandparents, their loved ones, their vulnerable loved ones. But a minority of people are putting the health of the nation at risk by not following the rules. That is why the Secretary has been more quickly to issue in the fines where people are clearly breaching coronavirus regulations. If you do not play your part, our selfless police officers who are out there risking their own lives every day to keep us safe, they will enforce the regulations. And I will back them to do so, to protect our NHS and to save lives. Our police officers are not immune from the virus. Far too often in their own health by coming into close contact with people, including those who deny the very existence of coronavirus. And anyone who is in immediate danger should always call 999. We are now at a critical stage in our battle against this virus. To protect those that use lives, I'll now hand over to Martin Hewitt, the Chair of the National Police Chief Council. Thank you, Martin. Dr Diwakar.
Thank you, Home Secretary, and good afternoon. My name's Vin Diwakar, and I'm the NHS England Medical Director in London.
Questions. I think our first question this afternoon is from Ian from Preston. It's a really important question, actually, about prioritisation and the groups that are being prioritised right now and focused on. Dr Diwakar has already mentioned the Excel Centre, which is doing great work in terms of the vaccination and getting the vaccine out. But effectively, we do have the JCVI, which has already identified the top priority groups who account for 88% of those who are affected by COVID, and give everybody this assurance. We are looking at those who are on the front line, people such as police officers, teachers and others who naturally are at occupational risk of coming in contact with the virus. You've all heard me speak today, and Martin, about police officers, fire officers. There are many others on the front line, and we are absolutely working to make sure that, of course, we can get the vaccine to them, but that means working with the JCVI as well. The rules are actually very simple and clear. We are meant to stay at home and only leave home for a very, very limited number of reasons, staying local. And that equally applies to, exercise is important. It's important for people's health and well-being, and that equally applies to exercise. Thank you. Are clear. The rules are firm in terms of staying at home. And with that, of course, Dan, I think you've been showing some news bulletins recently of breaches that have been taking place, and you've been out with the police and others. So you'll know the difference between those individuals who have been compliant and those that are breaking the rules. The rules are tough enough. You've already heard 45,000 fixed penalty notices that have been issued, just in the recent time since we've been in this pandemic. So they are tough enough. The message is clear. We urge everybody to continue to follow the rules. The more we follow the rules, rules, the sooner we can drive this awful, atrocious disease down. And the reason why we have these rules are to absolutely try and contain the pandemic and to save lives. So, by sticking with this, and that is the message to everyone again and again, stick with the rules, think about your actions, stay at home, stay local, and minimise your social contact. And of course, we will get on top of this pandemic. And importantly, we'll be able to protect the NHS so that the NHS can continue to look after people that are ill with coronavirus and also roll out the vaccine in the way in which we're now seeing this incredible mass vaccination take place across the NHS. There are endless discussions taking place about, the state of coronavirus, support and capacity within the NHS, and also lockdown measures right now and rules per se. Now, we're not going to speculate on anything. Conversations always, these issues are live within government, and rules and ways of working are always under review. So, we are constantly right now looking at where we are at. Sadly, you've seen the fact that too many people are still succumbing to this dreadful virus. And the fact of the matter is right now, we want people to very much, follow the rules that are in place right now, because by following those rules, that is effectively how we can collectively whack this virus down, get this virus down, free up capacity in the NHS, and obviously do even more when it comes to rolling out the vaccine. So, and understand that when it comes to our outstanding police officers, they exercise their professional judgment constantly, and they have been, as Martin has said, since day one of this pandemic, through the regulations, through the guidance that comes out through MPCC and through the College of Policing. Now, obviously, in the case of Derbyshire, the local police force reviewed that entire case. They looked at it, and the fine was actually rescinded. But look, I think we have to come back to the current state of play and the situation that we are in right now. The fact of the matter is we are in a pandemic, we're in a health pandemic. You have already heard me say the number of people that have passed away, died, 1,243 fatalities reported today. When we have people dying, when we have people tragically succumbing to this virus, we all have to exercise our judgment and be very conscientious as to how we act. When it comes to exercising, again, I do say stay local. Staying local is absolutely crucial. By all means, take your daily exercise, but it's up to all of us in the right way to exercise that judgment as to how we do it, not socialising, making sure that we're acting in the right way, staying away from other people, which is clearly what the Prime Minister did when he was taking his daily exercise. And I think, quite frankly, we all have to ask ourselves, what can we do to keep everyone safe and absolutely reduce our contact with each other? We are meant to stay at home and only leave home for a very, very limited number of reasons. And that is obviously to go to work only if you cannot work from home. In terms of schools, the schools are open for the children, pupils of key workers. And then, of course, outdoor recreation, but in a very, very restricted and limited way, staying local. I've said that several times over the last week. And obviously people that need medical help and support. And you've heard me speak frequently as well about those that could suffer from violence, domestic abuse, etc. These are very, very limited reasons for leaving. And I think, I can only actually echo the words of Dr Diwakar. We are in a health pandemic right now. Everyone has to be conscientious in their actions and almost act and behave as if we have COVID, therefore restricting all our social contacts. So the rules are clear. And in terms of police enforcement, we've spoken at length, not just today, but previously, Martin and all my brilliant colleagues across policing, as to the type of egregious breaches that we will clamp down on. So the rules are clear. Martin, do you want to add anything to that at all?
No, I think it is really just to make that point that the stay at home, the reducing contact, I think that is very clear. And certainly from our perspective, we will carry on engaging with people. That's how we have done this from the beginning. We will talk to people and we will explain. But I think the rules are clear enough for people to understand. We are 10 months into this process. And you're right that the regulations have shifted over that period of time as the pandemic has. But I think it's very clear what people need to do. And people need to accept the personal responsibility to act properly to prevent the spread of the virus.
Thank you, Mark. We're going to move on to Dan Hewitt from ITV, of all, and then I'll bring Martin and Dr Diwakar in. I think it's really rules. I think our message is absolutely crystal clear. This is to stay at home. And if I mention as to why, you've all heard us say this and others across government, CMO and many others about the impacts on the NHS. The rules are actually very simple and clear. We are meant to stay at home and only leave home for a very, very limited number of reasons. And that is obviously to go to work only if you cannot work from home. In terms of schools, the schools are open for the children, pupils of key workers. And then, of course, outdoor recreation, but in a very, very restricted and limited way, staying local. I've said that several times over the last week. And obviously people that need medical help and support. And you've heard me speak frequently as well about those that could suffer from violence, domestic abuse, etc. These are very, very limited reasons for leaving. And I think, I can only actually echo the words of Dr. Diwakar. We are in a health pandemic right now. Everyone has. The government published its vaccine delivery plan, and you've all heard about the big vaccine centres in particular, and the number of people that we're concentrating on in terms of getting the vaccine to. These vaccination sites, you would have seen the pictures, I think many members of the public have as well, have seen how cubicles are spaced out, and obviously we're working with Public Health England and following all the guidance in terms of the safety and protective measures that are required for the staff in those centres, but also for the individuals coming in for the immunisation. So if I can just go to Dr. Diwakar, because obviously we've been speaking.
We have absolutely rigid standards of infection prevention control in all of these vaccine centres. I think NHS staff, for them, they see their colleagues who are working on critical care and in general in acute wards, and they know the pressure that they're working under to how these centres are set up. We've spent months preparing to set these centres up, and we're guided by really strict rules about the way in which they should be configured in order to...